Hi everyone, this is Danielle again. Welcome to the video for Module 1, which is an introduction to holistic integrated healthcare. For this first module, I'll be going into a bit more detail on the content of the readings, but future videos will be less detailed, so you'll really need to get most of the content from your readings. We're going to start in Chapter 20 because it gives a really good overview of the various terms that we'll be using throughout the course, which can sometimes get confusing. In the left column here, you'll see different treatments that are typically considered conventional medicine, or it may be referred to as Western or allopathic medicine. That's things like pharmaceuticals, chemotherapy, surgery, etc. In the right column, you'll see examples of complementary treatments such as dietary supplements, deep breathing, chiropractic, and other therapies. These are called complementary because they can often complement other therapies or treatments being used. The word alternative medicine is used to describe interventions used alone without Western medicine or as an alternative to Western medicine. Integrative medicine combines these and is the term used when a person uses complementary interventions in conjunction with Western medicine. Complementary therapies have been used for centuries, and their use really became prevalent in the United States in the 1990s when David Eisenberg published a study revealing that 1/3 of Americans were using alternative therapies. There are several reasons why complementary medicine has gained in popularity. Many of the interventions can be used by people independently. There are reports of adverse drug reactions and side effects from conventional medical care. Many practitioners of complementary therapies tend to provide more personalized care, and research about the benefits of complementary therapies continues to grow. So there are definitely questions that you need to ask when thinking about complementary medicine. Many of these questions will be covered in the rest of the class. However, as we progress through the semester, it's helpful for you to keep in mind your own values, beliefs, preferences, and whether any of the therapies we discuss are in opposition to that. It's also important to remember that your future clients and patients hold their own values and beliefs, and it will be important to find a way to offer information about complementary therapies without forcing them on others, because some therapies may be in opposition to the religious beliefs of the client or patient. Throughout the class, we'll be mentioning different websites that can be used for resources. I recommend you start a running list with the websites you want to remember. Here are two of the most important websites that I hope you remember from this class. It's the National Institutes of Health and the National Center for Complementary and Integrative Health. So what is holistic? Many ancient healing traditions have a belief that wellness exists when there's a balance of physical, emotional, mental, and spiritual components of our being. Our physical bodies have an innate tendency to work towards equilibrium, meaning we have a built-in potential to maintain health and overcome illness. Emotionally, we strive to feel and express the entire range of emotions appropriately. Mentally, we seek a sense of self-worth, accomplishment, and a positive self-identity. And spiritually, we seek connectedness to others and or a higher power or divine source. When all of these components are balanced, this is considered wellness and a holistic approach. Similarly, illness is considered an imbalance of these components. Let's talk about mental health, for example, anxiety and depression. So a conventional Western doctor might simply prescribe anti-anxiety medication or an antidepressant medication. A physician who has a more integrative philosophy might look at both conventional Western fixes, like medication, but might also ask about your dietary habits. Processed food can cause changes in the brain, which make it an environment where anxiety and depression more easily arise. The integrative physician might ask about your movement, a sedentary lifestyle versus active. Activity creates a growth hormone called BDNF, which helps your brain to be a fertile environment for a sense of well-being. The integrative physician might ask about your stress levels and whether you have tried some coping strategies such as mindfulness meditation, which neuroscience research has proven can rewire your brain for peacefulness. So here's a reflection question for you. How do you react when you experience a headache, indigestion, or other symptoms? Do you quickly try to eliminate them with medications, or do you first take time to understand the underlying cause so that you can prevent them in the future? So most of you probably know the differences between acute and chronic illness. For acute illnesses, pharmacologic and technical advances in conventional medicine have halted heart attacks, mended bones, and eliminated infections. However, the caring components of conventional medicine has shrunk over time. Healthcare providers often no longer have time to really get to know the patient as a whole person. Therefore, conventional medicine is less successful at managing chronic conditions than at treating acute conditions. People with chronic conditions are increasingly incorporating complementary interventions into their care. Complementary practitioners invest more time in getting to understand their clients and patients, encourage an active provider-client partnership, empower clients for self-care, promote healthy lifestyle practices, and treat the whole patient rather than just treating the symptoms. Another major component for self-care is self-awareness. A person needs to know their body to help them when making decisions about their care. Let's go back to the example of anxiety. Let's say there's a patient with anxiety who would like to try using aromatherapy. Perhaps she's a college student who has test anxiety and has heard of the calming effects of lavender oil. So she has a decision to make. Will she just use conventional medicine, such as asking her physician for some Ativan that she can take before exams? Will she only use lavender oil as an alternative to anything else? Or will she integrate both the Ativan and the lavender oil? She first has to be self-aware of her own body and her own life so she can make an informed healthcare decision. She needs to know about her physical health. What if she has an allergy to lavender? She also needs to be aware of her emotions. Is the anxiety generalized throughout her life, not just specific to exams? Does the anxiety end up ruling her thoughts and behavior? Might it be helpful to have the Ativan as a backup for a few months while she is learning mindfulness meditation in conjunction with lavender oil until she becomes so good at calming herself that she might not need the Ativan any longer? From a holistic point of view, each individual has the responsibility to be self-aware so they can make the right decision for themselves. So in this class, I hope you will look at everything you learned from two viewpoints. The first viewpoint is seeing yourself as that patient who is trying to make the right decisions for yourself. The second viewpoint is from the perspective of a healthcare professional who's trying to help the patients make the right decision for themselves. So holistic care is not synonymous with complementary medicine. Holistic care implies a balance among mind, body, and spirit, so it may use complementary therapies, alternative therapies, conventional medicine, or a combination of all of those, which would be an integrative approach. Please complete the self-assessment, which is on page 7 through 19 of the textbook. It won't be graded, but it is essential to your being able to complete the final project.